Hey, I'm Kiyomi,
I'm Brecklin.
and this is our final capstone presentation.
Hope you like it.
Introduction. Mike is a 46-year-old male who works as a security guard at the University of Regina. He lives alone, struggles with cooking healthy meals, and finding time to work out. Being a security guard, Mike works a lot of shift work, which prevents him from working out as he sleeps during the day. The interview took place in a busy hallway at the university, which made it difficult for both us and Mike to focus. There were a lot of distractions coming from other people, which took the attention off Mike and the importance of the interview.
Learning goal and objectives. Our overall goal for Mike is to improve his physical health. He told us that he would like to become more physically active but has a hard time being active as he is always working shift work. He would like to find new employment that doesn't require shift work and learn to eat healthier. Mike's objectives for reaching his goal include: number 1, creating a workout schedule to accommodate his shift work. This way he doesn't have to plan out his day as it is already planned out for him. Number 2, inform him of various workout classes available at the university. This way he can find time to work out either before or after his shift is done. For example, available classes could include spin classes, Zumba, yoga, or resistance training. And number 3, journal the days he works out. He would write what exercise he did and for how long. We can help Mike reach his goal by creating a meal plan, sign him up for workout classes, review his journal, and offer motivation along the way.
Connection to nursing. As nurses, it is our job to promote health awareness and prevent illness. We will encounter similar situations like this as nurses quite frequently in the future. Many people struggle with finding the time and motivation to work out. The client education model is a key component of health education. There are 4 components to this model. They are nurse as educator, client as learner, nurse-client relationship, and client education outcomes. This is important for us as nurses because health education promotes, retains, and restores health, as stated in Miller. With Mike, we are trying to encourage positive changes in his lifestyle, which is a goal of health education. We are trying to educate Mike with the end goal of achieving optimal health and well-being. As quoted in Miller, health status is affected by a variety of factors such as lifestyle, heredity, environment, and the availability of health care.
Mike's lifestyle influences his health greatly because of where he works and the lack of support from his family. As stated in Miller, clients' motivation and perceptions affect learning about health. Mike is motivated to learn and knows that he needs to make lifestyle changes to improve his health. He knows that he is responsible for his overall health and knows what needs to be done in order to make these changes. The nursing process is the first component of the nurse-client relationship. Its focus is to address client problems in a professional practice in a variety of clinical settings. The steps of the nursing process are directly related to the learning needs of clients and are designed to improve health knowledge and to promote, retain, and restore health. The 36th SRNA competency states that nurses have to analyze and interpret data obtained in client assessments. It is our job to analyze everything that our patients tell us in order to improve their quality of health. Another important competency states that we have to facilitate client engagement in identifying their health needs, strengths, capacities, and goals. We have to identify their needs to improve their health. We also have to determine what their strengths and weaknesses are in order to create a plan that will help them reach the goals they want to achieve.
Education process. We use the education process as outlined in Miller to teach Mike about how he can improve his physical fitness. The assessment piece was crucial to learn about Mike's past history and what physical state he is in now. We learned about his living situation as well as his work environment. We discovered that Mike lives alone and works a lot of shift work. We asked him various questions about his life, such as where he lives, who he lives with, how often he eats takeout, what a typical meal looks like, how often he works out, what stops him from working out, and so on. These pieces of information Mike had verbalized to us aided in the evaluation of his overall physical health. We planned out a work schedule for Mike, as well as other ways to achieve his fitness goals.
Kiyomi and I could create a workout schedule for Mike that revolved around his work. If we had implemented our plans, we would have evaluated Mike's progress throughout the duration of the time frame that we had allotted him. We would check in with Mike every week to assess his progress and talk about any questions or concerns he had regarding his new care plan. We would read what he had documented in his fitness journal, which would tell us what types of exercises he did in the gym, as well as how many calories he consumed per day. As stated in No Time to Teach, the ultimate goal of patient and family education is to improve health outcomes. There are 2 levels to patient education. Number 1 is teaching information and skills, and the second is helping the learner apply these new skills to his or her life. We used this theory while teaching Mike. We taught him how to manage his time wisely, as well as signing him up for workouts classes at the university when they worked for him. One of the factors affecting learning that Mike demonstrated is readiness to learn. As stated in Cozier, the demonstrated behaviors that reflect not only the client's desire or willingness to learn, but also his or her ability to learn at a specific time. Mike has demonstrated that he is completely ready to learn and is willing to put in the effort to see effective and positive results. Conclusion. By interviewing Mike, we have been able to apply all of the learning theories that we have been taught in class. We have implemented the skills from class and have learned how to teach clients. We built on our interviewing skills and have gotten more comfortable with speaking to our clients. We learned how to use the education process and how to effectively communicate with others. We learned how to apply the theories to nursing, which will benefit us in the future. Since our first interview with Mike, he has found new employment with the Department of Agriculture at the university.